Hi all, this is the video about digestive tract or alimentary canal for medical coding students. In this video, I explain about the parts in the digestive system, then stages of digestion, then medical terminologies and the pathological terms which is related to the digestive system. What are the parts you have in the digestive tract? It is starting from the mouth, then pharynx, that is otherwise called as throat, then esophagus, stomach, small intestine, large intestine, rectum and anus. Then what are the stages you have in the digestion? Mechanical digestion, chemical digestion, absorption and elimination. What is mechanical digestion? The breakdown of larger food particles into the smaller particles. That is what physical digestion or mechanical digestion, which is happening in the mouth by the help of tongue, teeth and the salivary juices like saliva. That we have three salivary glands: parotid, sublingual and submandibular. By that the digested food, which is called as bolus, that will be transmitted to the stomach. Then the other enzymes will be produced there. HCl, pancreatic juice, bile, maltase, amylase, lipase kind of enzymes will be produced there. Then the food will be digested by the chemicals, that is chemical digestion, that is called as chyme. Then we have a structure called sphincter, that is a ring muscle between esophagus, lower face of the esophagus and the upper portion of the stomach, that is called as lower esophageal sphincter. That helps in the backflow prevention activity, like valves we have in the heart, same we have there. Then one more in the lower portion of the stomach and between the small intestine, that is called as pyloric sphincter. The main function is to prevent the backflow. That is the function of that ring muscle. Then the absorption phase, which is happening in the small intestine. We have a projection, hair-like structures, folding-like structures in the inner portion of the small intestine that helps to increase the surface area. By that, in the short time, the intestine can absorb more nutrition that will be transported to the blood. Then the waste material will be transported to the large intestine. Then the water will be reabsorbed from there. Then the waste content, solid waste content, that is called as stool or feces, which will be transported to the rectum. Then that will be excreted or eliminated through the anus. These structures are attached to the abdomen wall through the structure called mesentery. That is the structure which holds the intestine, other abdominal contents there. Then we have additional structures like liver, gallbladder, spleen and pancreas. Those are the structures we have inside the abdomen. Liver is the largest organ, which is located in the upper quadrant, right upper quadrant of the abdomen. That secretes bile that will be stored in the gallbladder, which is attached to the liver. Then we have a structure called pancreas that will produce insulin and other pancreatic juice and glucagon kind of enzymes. That is enough for you. Then we talk about the medical terminologies which is related to the digestive tract. Absorption, that is nothing but absorbing the nutrition from the small intestine into the bloodstream. That is what absorption. Then alimentary canal, that is the other name for digestive tract. Then amino acid, amylase, maltase, lipase, pancreatic juice, bile, they are the digestive enzymes digestion. Then bolus, masticated food or mechanically digested food. It is otherwise called as intestine. Then in the teeth we have types: incisal, molar, premolar, and canine. We have types of teeth. Then cardiac sphincter or lower esophageal sphincter. This is a ring muscle which helps to prevent backflow between the esophagus and the stomach, then stomach and the small intestine. Then cecum, we have small intestine that is 7 meter in length. We have two divisions in the duodenum, jejunum and ileum, 2.5 meter, 2.5 meter and 2 meter. Then colon, it is otherwise called as large intestine. This is 5 feet in length. Then cystic duct, which connects gallbladder and the liver. Then common bile duct, which connects gallbladder, liver and the digestive tract. Deglutition, swallowing, and swallowing the food. Then pulp, that is a soft structure which is present inside the food. Then over that we have membrane, then above that we have enamel. Then digestion, breaking the food, larger part of the food molecules into smaller parts, that is what called as digestion. Then emulsification, digestion of the fat, the complete process is called as emulsification. Enzymes, chemical. Etiology, reason for some disease, that is what called as etiology. Idiopathic means unknown reason. Due to the unknown reason, some pathology is happening or some disease are happening, that is what called as in that case that is called as idiopathic. Then frenulum, that is a covering layer of the tongue. Then papilla, over the tongue, that is a taste bud. Then gallbladder, that is a pouch or sac-like structure which holds bile, which is produced from the liver. Glucose, simple form of sugar. Glycogen, that is a stored form of glucose. Peristalsis, the movements which is happening in the intestine, that contraction, relaxation kind of, like this contraction, relaxation, this is happening in the intestine to push the food particles in the intestine. That is what called as peristalsis. proper digestion of the food. Then flatness, gas expelled through the anus. Flatulence, excess gas in the stomach and the intestine. Gastroesophageal reflex, when there is a problem in the sphincter muscle that leads to eructation, then or a reflex. Gastroesophageal reflex, what you ingest, what you swallow, that will be coming out in this. That is what gastroesophageal reflex. high level of bilirubin in the blood. That is what called as jaundice. That causes excessive destruction of RBCs, red blood cells. Then nausea, vomiting or unpleasant sensation. Pyrrosis, it is otherwise called as heartburn. Then aphthous stomatitis, inflammation in the mouth, ulcers. Dental caries after hepatic stomatitis, inflammation in the stomach due to throat infection. Oral leukodystrophy, that will be a patch-like ulceration in the mouth. Mucosa, it means in the corner of the mouth. Periodontal disease, inflammation and degeneration of the gums and teeth. That is what periodontal disease, the disease which is related to the gums and the teeth. Anal fistula, that will be a tube-like ulceration or a sore on the anal region. That is what anal fistula. Fissure, that is like a crack in the anal region. Colorectal cancer, spreadable tumor in the colon and in the rectum. Diverticula, there will be a small pocket-like projections from the intestine. That is what called as diverticula. Dysentery, there will be a painful watery stools passing with blood. That is dysentery. Esophageal varices, there will be a twisted bulged veins in the esophageal region. Then hemorrhoids, this is otherwise called as piles. There will be a swollen, twisted, varicose veins will be present in the rectal region. Then hernia, protrusion or bulging, the contents which is coming out from the abdominal area. That is what where the muscles are weak. We have a gap there. The abdomen contents will protrude out from that particular area. That is what hernia. Based on the area, that is called as inguinal, umbilical kind of types we have. Then irritable bowel syndrome. There will be a constipation or sometimes diarrhea, then bloating, lower abdominal pain, which is most of the time related to the stress and the tension. That is otherwise called as spastic colon. There will be a tightness in the colon, lower larger intestine area. Then ulcer, sore or lesion, mainly in the intestinal area. Then ulcerative colitis, inflammation in the colon along with ulceration. Then cirrhosis, it is a degenerative disorder. There will be a degeneration of cells in the liver, common in the alcoholism. Gallstone, there will be a formation of stones from the bile, that is called as gallstone. Pancreatitis, inflammation in the pancreas. Viral hepatitis, inflammation in the liver due to viral infection, hepatitis A, B, C and E. Then diagnostic terms, ALT and AST, alanine transaminase, aspartate transaminase. When there is a liver damage, there will be a elevated this particular enzymes that indicates there is a pathology in the liver. Serum bilirubin, that is the other test to find out jaundice and other liver related diseases. Then stool culture to examine the microorganism in the stools. Then lower gastrointestinal series X-ray. In this, contrast material will be injected, then the X-ray will be taken. In this, barium enema will be given to the patient. Then the lower tract of the gastrointestinal tract will be examined. Then upper gastrointestinal series, in this barium sulfate mixed fluid will be given to the patient. They will swallow that. After that they will take the x-ray, so we can easily examine the soft structures through the x-ray. CT, ultrasound, through that we can examine the size, shape and the density of the organs. Then gastrointestinal endoscopy. In this procedure, small flexible tube will be inserted through the mouth to the anus to visualize the parts in the gastrointestinal tract. Then liver biopsy, small tissue will be cut from the liver. Then that will be sent for the culture to find out the pathology, mainly the neoplasm, that is tumor. Then nasogastric intubation, inserting a tube through the nose to the stomach